Welcome to Do You AGRAY, a space where we have real conversations. I'm your host, Bassam, and today I have with me Kevin and Jermeen, my co-hosts, and we're privileged to have Dr. Anthony Frank with us today. He's a licensed naturopathic doctor from the state of California. We're excited to have you here with us.
Glad to be here. Thank you guys for having me.
Yeah. Honestly, I've always been interested in nutrition and exercise. I majored in exercise science in college, and after I switched from business to exercise science because we were playing sports, and we were just there was a time when we switched our mindset, and we were so much more interested in health and diet and all these things. And I wanted to start off by asking this question: are you a real doctor? Here's the thing. I'm a dentist. So there's just this joke that goes around that I'm not a real doctor. And my brother's a chiropractor. The same thing goes around. So the question to you is, are you a real doctor? I guess in the terms of, was there any medical school that you had to do?
Yes, great question. Yes, I am a real doctor.
Nice.
As a naturopathic doctor, we go through 4 years of naturopathic medical school. So we kind of go through the same didactics, which means the same type of education where we're doing, biochem, where we're doing, cadaver labs, the same thing like the first 2 years of medical school, learning about the body, learning about all the functions of the body. The difference is in the last 2 years, our rotations are more surrounded with family medicine as well as naturopathic approaches. So anywhere from, physical medicine to homeopathy to just a slew of natural approaches that can be used. So yes, I'm a real doctor. I have a doctorate degree. Did my 4 years. The student loans reflect that. So
that's one of the first.
So yeah.
What are the student loans like? What's the average?
Same as medical school, actually. Okay. So it'll still be a couple 100,000.
Wow.
Yeah.
Not as bad as $500,000 here.
Yeah. Yeah. Those are some scary numbers, but they do add up. Yeah.
They do. Well, we want to learn a little bit more about what's naturopathic, everything that has to do with what you studied and how you run your practice. But before that, I want to know about you as a person. Where do you come from? Where were you born? Where did you grow up? What made you decide to go into this field?
Yeah, so I was born in the U.S. Virgin Islands. Grew up in the British Virgin Islands. The Virgin Islands are a group of islands that are close to Puerto Rico. Everyone kind of knows where Puerto Rico is. So you go east of Puerto Rico and you'll hit the Virgin Islands. So I grew up there. For the most part, that upbringing is what kind of led me into naturopathic medicine, because I knew I kind of always wanted to be a doctor. I just wasn't sure what type of doctor yet. So as I was going through my upbringing, my grandmother, Veronica, I always put that she's the greatest inspiration that kind of led me in this direction. She did a lot of what we call botanical medicine. So herbs, teas, all of that. So whenever we were sick, we didn't take medications or go to the doctor as much. She would have a remedy. My mom would call her up, or she lived on a different island, still close enough. We'd go up to her. She would give us herbs. She would just take really good care of us. So as I went into my undergrad, did my bachelor's biomedical sciences, I actually did also my associates in radiology. So I was an X-ray technologist.
Cool.
Knew I wanted to become a doctor, but just being in the hospital environment and having my background, I was like, I need to be a different type of doctor.
Stressful.
Yeah. So then looking at it and seeing and learning of naturopathic medicine through, I think it was a documentary, Forks Over Knives. I saw that ND title and I'm like, what is that? Yeah. And it just aligned with who I am.
Okay.
So
yeah, I've seen that. I think we watched it together.
Yeah. It's a really good one. If you haven't seen it, I think it's an older one now, but Forks Over Knives.
Yeah, they'll have a few other ones, I think.
Yeah.
Too. Cool. Yeah. So what did you do? You went to undergrad, and then from there, you went to the specialty school? Yeah,
so from undergrad, you do need a bachelor's. So my bachelor's in biomedical sciences. And then from undergrad, I did take my MCAT getting ready for allopathic or MD medical school. But like I said, it just didn't align with me as much. So I worked as an X-ray technologist for a few. But after learning of naturopathic medicine, I applied to naturopathic medical schools. in which California does have a satellite branch called Bastyr University. That's the one I attend. But Bastyr University is the kind of the main school, I think the most or the best known school, I'd say.
Yeah.
And there are just a couple schools around the country, some that are starting to open up as time goes on, but there used to be a lot more. But the shift in medicine and just history and different things did cause some to close down, but it's on the uprise because people are craving natural health. They're craving things that can support longevity.
Oh, yeah.
So, yeah.
For sure.
100%.
Awesome. So another quick question. What is your specialty and what do patients usually come to you for?
Yeah. So I specifically specialize in injection therapy and hormone replacement therapy. So when we say injection therapy, we're talking IV nutrient therapy. So the typical IVs you may know of are like saline bags or, a banana bag, something to rehydrate. There are ways that we can introduce nutrients into the body to be able to bring about more healing, support health. So understanding those nutrients, the blend of those nutrients, that's one of my fortes. Another branch of injection therapy is actually regenerative injection therapy, which helps with joint and ligaments and just kind of using the body's own factors to try to help heal itself. So that's another aspect. And then, of course, I'd say my biggest forte is hormones and hormone replacement therapy. And just assessing hormones and being able to give bioidentical, and not even to that extent, be able to support the body. It could be with herbs, it could be with nutrients, or it could be with bioidentical hormones, which will then help the body to just balance out and function better.
Nice. Yeah, it's. I feel like with the decline in lifestyle and diet, and then just so many like GMO foods, and it's just you're not getting all the nutrients that you need.
Yeah.
You try and but you're almost somewhat deficient in something.
Yeah.
And then so many of us have certain mutations, possibly that minimize our ability to absorb certain nutrients. And I think so the IV treatment is to skip that process and get it directly into your blood.
Very helpful.
That's right. Spot on.
Okay.
Definitely is able to support, by bypassing the GI or gastrointestinal system.
Nice.
Yeah.
Nice. I want to get one of those.
Yeah. Come on through.
Look me up.
I got you.
So, you had a question, Julie?
Yeah. So I have a question. Do you think there is an ultimate, being in nutrition, the field, do you think there is an ultimate diet that you recommend for everyone? Is it one diet fits all, or different people need different diets?
You hit the nail on the head. Great question, number one. There is no one diet fits all for everyone. There are fad diets that tend to pop up, but in what I practice, it's more individual medicine. So you want to make sure that the diet that you're wanting to use is going to be healthy for you. So that diet could comprise of, anywhere from being a paleo diet to a ketogenic diet to a vegan diet. All of those diets, and there are many diets out there, but all of those diets do work in different ways for even different ailments. Like the ketogenic diet was actually birthed out of, I think, patients that had seizures. And of course, fats are a great way for the brain to function a little bit better, decreasing the glucose amount, balancing the protein. So that came about, but then people started to notice, people are losing weight. This seems to be a great weight loss alternative. So all these diets do have their benefits, but it's the one that works for you. And sometimes it does take trying a couple. We grow up in different cultures that introduce different diets to us. And
for sure,
most of the time, culturally, our backgrounds do kind of reflect what we need. But and like you said, with the changing in our environment, our bodies do tend to lack some sort of deficiency or have some sort of reaction that certain diets just won't work for us.
So let's say a client comes to you and they're asking you, like, what diet should I, go on?
Yeah.
What do you base it on? How do you guide them to what the diet that they need?
Yeah. Well, I always start off with avoid a sad diet, which is a standard American diet.
Yes.
And honestly, it's more so avoiding fast foods, avoiding high fatty foods, high sugary foods. So
good though.
I know it's working on our receptors. Biochemically, it's changing neurotransmitters, all of that. Sometimes I think there's related glucose to kind of hit in certain areas in the brain that certain drugs do. So So with that, it's more of like be able to avoid those as best as possible. Start off with a whole food diet. Plants primarily. If you're gonna have meat, make sure they're organically sourced. Make sure if you can grow your own stuff or have your own animals, that's the best case scenario. But making sure that you get the highest quality of foods, and then within that we could kind of maneuver and see which ones would be the best fit. But always starting off with a whole food diet. So fruits, vegetables, nuts, seeds, healthy fats. Definitely looking at, if you're going to introduce the meats, making sure that they're healthy as well. Yeah.
So for me, for example, as a vegan, you always get asked the question, where do you get your B12 from? Your omegas,
Yeah.
So what I usually say, okay, it's fortified in some almond milk or or some supplements, but is that enough?
It is, especially if you're being very specific about looking at where your B12 is coming in rather than just eating more vegetables. Naturally, yes, you are going to have a higher intake of micronutrients, so all those B vitamins and cofactors. But sometimes in different cases, if you have a demanding job, if you're stressed out, some of those nutrients gets used up a lot quicker. So yes, if you do adhere to a certain diet, like in this case being vegan, being sure that, let me pay attention to my B vitamins, B12. Let me pay attention to my omegas, and everything that does have a plant-based source. Yeah. So even with iron, as a vegan, you could have heme iron is found in like meat, versus, and it's slipping my mind, the other type of iron found in plants. But they're two different irons. The plant-based one is just a little bit harder to absorb, but you're still able to get iron in your body if you're being very diligent about it. So yeah, there are ways you can do it. And a lot of foods do tend to be fortified, which is good, but that doesn't always fit the bill as for matching who you are and what you're going through. Yeah.
Makes sense. What about protein?
Good question. A lot of our focus tends to be, at least within an American society, on protein or more protein, where honestly we do lack fiber, mainly because people are either doing protein shakes or increasing their intake of meats and not have enough fiber.
The salads.
Yeah, salads, your green veggies, just raw veggies even, to be able to kind of support your GI tract. So proteins, unless you're an elite athlete and you need to bulk up and get all of that in, your proteins are probably going to be sufficient if you have just even a typical diet where you consume beans, legumes, meats even. Your protein's going to be covered. It's the fiber that we more so need to focus on. Yeah.
And where can you get fiber from?
Salads.
Dark green leafy vegetables, raw veggies in general. So even if you consume, carrots, kale, all of that, some veggies are harder to consume. Example, kale. But massaging your kale in a little bit of apple cider vinegar and some oil and lemon and just supporting it, those are all good sources of fiber.
Cool.
So, yeah.
Amazing, yeah.
Yeah, I remember being in college, I took a elective for my master's, and the health teacher, she stressed fiber.
Yeah.
It's so important.
Yeah, it really, really is. And, the first thing we do, as I say in the naturopathic world, or as we say, it starts in the gut. So you have to eat to live. So by addressing how your gut is processing food, and also addressing what types of food you're able to put in, is going to go a long way. And a lot of our chronic diseases is related to low fiber, or not having a good colon in transit time. There are people who don't use a bathroom every day.
That's true.
There are people, who don't use a bathroom every week. So that's not a good situation. So yeah.
So what else would be helpful for gut health? How important is that?
Gut health is very important because it more or less has your biggest immune system, your gut-associated lymphoid tissue. So gut health is the first line of defense, one of the first lines of defense for your immune system. So you want to make sure that that entire microbiome, that entire gut environment is balanced and healthy, because it does tend to go off balance from day to day even. So things that would be important would be, of course, the fiber. That's going to be a big one. Second would be, I would say, being a little bit more diligent with the type of probiotics that you may get. And you don't have to take a probiotic supplement. It can be from fermented foods. Yogurt is a common one, but you can also do, in different cultures, you have kimchi, you have sauerkraut, just these different fermented foods. They actually have good pro and prebiotics. So all of those do tend to balance each other and kind of go in line with supporting your gut health. But yeah, gut health is pretty much, the start of everything. If you're going to try to heal the body, you got to at least make sure your gut is working properly. Yeah.
Makes sense.
So what sets your profession apart from just, what is it, regular medicine?
Modern medicine. I would say naturopathic medicine is a good blend of allopathic or modern medicine, in which, we're ordering labs and assessing the body, doing physical exams, all of that, along with bringing on board naturopathic practices of looking at diet and lifestyle and making sure that, mind, body, spirit are all in line. So I always kind of term it's a good blend of a primary care medical doctor, a chiropractor, because we do learn manipulation, a nutritionist, and then of course on top of that there are the specialties such as homeopathics and all of that. So
amazing, got all in one.
Yeah, all in one. And so that's kind of that's what differentiates us more or less, in that I do come in with a modern perspective of, okay, what do your labs show? And then from there, I can build out a plan that kind of is tailored around not just what medications you might need, but more so what supplements, what herbs, what foods would be beneficial to keep you in the long run.
Treating the whole thing.
The
First
whole
the
body.
whole,
That's right.
That's great.
Do you prescribe medications or no?
I do, yeah. And medications are needed in certain cases.
Okay.
Medications in and of themselves were developed to save us. It's the overuse of medications that tend to lead to issues, because if it's like a Band-Aid, if you don't really try to make sure that you're healing the tissue or supporting the body, then the medication, it's gonna complicate, or on top of that, the medication may lead you to have or need other medications.
This is a side effect?
Yeah, because of the side effects.
Wow.
So medications in certain cases are needed. If your blood cholesterol is hitting 400 or 500, you may need a statin, you may need something to really drop that number down for cardiovascular health and to make sure that you're okay. But while we're doing that, we're not just dependent on the medication. We're
healing.
Yeah, we're introducing, hey, get some more activity in, have some more fiber, have some healthy fats, have some specific herbs that help with driving down, garlic, all these different things that,
Love garlic.
Good. All these different daily foods that have such impactful results if we use them therapeutically.
Yeah.
Do you think traditional doctors are limited in their capacity to do as much as you do for your patients? Or is that a tricky question?
It's a tricky question. I can't speak for them, but I can say from what I've observed that it is difficult in the way medicine is practiced today. The insurance-based model does dictate that doctors have to see 15, 20, 30 patients a day in order to kind of just have a good practice or be able to support the community. Whereas, as in all medical schools, you are trained to sit down, take the time, gather information in order to be able to find the most appropriate treatment. So it's limited because the way medicine is practiced has become more of, like I said, toward the 5 to 10 minute visits.
Yeah.
You can't talk to anyone in 5 to 10 minutes
Yeah.
and really give them a good backstory about who you are, how you're feeling today and how you want to be in the future. So I can see from that perspective where things are difficult, and from being in that world, yes, I do see that. But at the same time, there are different ways. There are different doctors that I know who made it, like mandatory for them to sit down and take that time and change the structure of their practice and business. Most of the time, it does mean going outside of the insurance-based model. So, that's the only unfortunate part. But in certain parts of the country, I think of Arizona, Washington, Oregon. Speaking personally, naturopathic medicine is covered by insurance, so patients are able to get that's able to get that. Oregon, Washington, I know.
Wow.
Arizona, they do get insurance coverage and are able to. But even within that, there's still some practices that decide not to, because even though you can accept insurance, it doesn't mean that you're able to still practice that the way you're trained to.
I think also, from
No.
this liability standpoint, I think medicine has been so much about how can I protect myself from getting sued. And so you're not able to give all the knowledge that you have and the best recommendations to the patient. You're just sticking with the guidelines set up by associations and things like that. So to avoid, getting in trouble.
Yeah. And it's interesting that you said that, because I'll even piggyback off of that and say, they've even set up ways where now they've placed stools inside of patients' rooms to have doctors actually sit down and talk to patients, even if it's still going to be 5 minutes, because it's shown better outcomes for the patient. You feel as if you're relating to your doctor, So, there are ways that they're introducing or trying to reintroduce, hey, I'm here for you, I care for you, rather than being sort of an authoritative figure saying, oh, you're sick, this is what we're going to do to get you better. So,
So what type of clients come to see you? Is it people who try traditional and they're like, I need something that works? What are the type of people, and how would we pay for something like that if there's no insurance?
Yeah, so if there's no insurance, it is, fee for service. Good thing is with certain type of insurances, whether it be PPOs or if you're in a good company that gives you an FSA, flexible spending account, those are, you can get that covered or reimbursed. So you still pay up front, but then you should be able to be reimbursed, because I'm doing the same thing. I'm providing diagnosis codes and, like I said, practicing as a doctor, physical exams, ordering labs, all of that. It's out of pocket. So if those are there, that's great. If not, it does tend to be a little difficult, which is why I always try to meet the patient where they are. I will try to give you the best care possible outside of how things may look. Because if you're severely sick and, we do understand financially things may be tough, I can either give you some recommendations as far as who you can see, or say, hey, you know what? Let's go ahead and take care of you and make sure you're good. But that's kind of the main way I would say, where if there is that setup, that's great. If not, it's mainly that fee for service that you pay for the care. And it is similar to, if you didn't have insurance, you'd be seeing the same numbers, honestly, if you went to see your primary care doctor. So that's the biggest thing I would say.
Yeah.
Cool.
Nice.
So let's say someone is coming to you dealing with menopause. All of a sudden they have hot flashes, or, getting irritable and anxious or down. Do you go straight into hormonal therapy for that person, or are there certain steps that you go through before that?
Great. Thank you for bringing that back in, because I think he had asked that. I do, someone that's coming in with a hormone sort of presentation, of course, first I'm going to assess and see to what extent exactly how is the menopause happening, what symptoms are showing up. And I'm always going to start with foundational things. So how are you sleeping? How are you eating? How is your GI system? And then building on it from there. Because I always want to first do no harm, or bring on board the least invasive approach. So most of the time that's going to be an herbal approach or a nutrient approach, or maybe even a lifestyle and diet approach to be able to reshift the body. Yeah. then we build on it from there to go into, okay, let's bring on board maybe some IV nutrient therapy, or let's bring on board some other factors that could help your body. And then, of course, which sometimes is the most effective within a menopausal or a hormonally deficient patient, going directly to the hormones, but still having that foundation, that background of, I understand you maybe, not only are you lacking in this hormone, but you're lacking in B12. So let's cover everything and make sure you're good, so that if we do bring on hormones, that it works properly.
Wow.
Because if you jump straight to a hormone, if you jump straight to a medication, they'll be like, why am I not getting the same results? And it could be from an underlying deficiency that, you may have glossed over.
Wow.
Yeah. So least invasive, and then just working the way up to probably bioidentical.
That's great.
And that's a key word, bioidentical hormone replacement therapy. Yeah.
So what's the difference?
So bioidentical means something that your body recognizes or relates to. Sometimes in hormones, it is derived from different sources, whether it be created synthetically or derived from equine or horse sources. So there are different ways that hormones can be, retrieved from other animals or animal tissues. Some of it may still be, I'd say, almost close to bioidentical. I think of the example of thyroid medication. There are porcine thyroid medications that have a better balance of thyroid hormones, and porcine means from a pig source.
Yeah.
But they have a better balance of hormones for the thyroid compared to just synthetic levothyroxine. And sometimes that works better for patients. Of course, given cultural, religious, all of that, there are ways to find other sources or balance that. But that's one key example that probably has a bioidentical, even though it comes from an animal. And then the other ways are the typical, well, you can synthetically create something that it looks like it was created in your body that still works better for your body.
Nice. Yeah. Wow. So much learning. So
yeah.
He almost.
You guys, let me know. Pace me. Rein me in.
It's good. One of the things we've been learning recently about is how a lot of things are sprayed with folic acid, which like bread and I think some rice and wheat. So apparently the folic acid is synthetic. It's made in the lab, so it's not natural source. And so supposedly if you have a specific gene mutation, it's called, I think, MTHFR, you are not able to methylate and absorb the folic acid, and then that leaves toxic waste in the body, and then you have all sort of complications after that. But if you go to Italy and you have pizza or pasta, you're fine. And they found out, I think, that the wheat in Italy is not sprayed with folic acid. So I want to learn more about this THFR.
That one?
I mean, it's a hater. It's so bad,
So I'll clear up what you said a little bit. So with the gene mutations, MTHFR is a very common one. And it's a very long name, but it's the actual enzyme that reduces your methylfolate, or your folate, which is vitamin B9.
Yeah.
So when it comes to folic acid, that is a more common way that we find B9 in the diet. In the case of a genetic mutation with the MTHFR gene, you have difficulty, as you said, methylating or activating that folate or, that B9 to be able to work in your body. On top of that, there are other genetic SNPs or other genetic factors that do play a role in how your body processes things. But touching on the wheat side, that may be dealing with something else when it comes to gluten. Because gluten, and more so gluten sensitivities, have increased due to some of the things that we do introduce into our foods and GMO sources of stuff. So gluten is playing that role when it comes to wheat and traveling to different countries, whereas a type of B9 folate is there or affects the genetic side / the MTHFR side of things. And while they're both different, they both do impact the way reactions happen in your body.
And so as a solution, do you completely, for somebody that has the mutation, Is it better that they completely don't eat any gluten, or is there a specific type of wheat or foods that they can?
Well, I wouldn't say that it's directly correlated with gluten. I would say more of the folate. You would need a methylated form of folate, whether you eat gluten or not. If you have celiac disease or if you have a gluten sensitivity, do avoid gluten, because that's just throwing off and causing more inflammation in your gut or in your body. But in the case of genetics, if you do have that MTHFR, which sometimes you have to be tested for, actually most of the time you have to be tested for, if that genetic SNP does pop up, you do have to directly consume things that contain methylfolate. And there are a lot of B vitamins that do have methylfolate. You just have to look out for it. And that methylfolate works better because, just as you said, your pathways function better. You're not building up toxins. Yeah.
Wow.
Versus, the food side of it with the gluten, that's just working through a different pathway altogether. And that key thing is trying to decrease inflammation in your gut from gluten or, just non-organic or just unsafe things that can kind of trigger inflammation in your gut.
Wow.
Yeah.
So what would be your take-home message for our audience, our viewers? What's something crucial? The biggest thing.
I would say the biggest thing is, especially following COVID, mental, emotional health. If you get that in check, if you are able to get that support, whether it be from family, friends, there are situations where you could be eating horribly, but you feel as if you're putting good things in your body and your body will respond in a positive way. So if you can support your mental, emotional health, that's going to be it's probably going to go the furthest to take you, into a long and healthy lifestyle. Building on top of that, foundational things. Sleep more, eat more veggies, and then going along with the mental, emotional, actually decrease your stress. Yeah, because all of these things do impact how our body responds, how our body builds things up and breaks things down. So those would be the two key things: taking care of your mind, mind, body, spirit sort of thing. And then on top of that, being sure to put good things into your body. Yeah.
Wow.
So a quick question for you. What's been the most challenging and rewarding aspect of being a naturopathic doctor?
Most challenging, I would say the most challenging would have been kind of correlated to just being a naturopathic doctor and not being as recognized as to what it is. Because naturopathic medicine, while it is old medicine, you could say, it comes from both Eastern and Western cultures combined. It's not been the mainstream form of medicine.
Yeah.
So just kind of advocating and saying, yes, I'm a naturopathic doctor. Yes, I do understand labs and I use lab for testing. Yes, I do understand autoimmune disease processes and I'm not here to, hijack someone else's career, but more so to support patients in all that they're going through. So yeah, that would be the most challenging, I'd say, just kind of advocating and saying, yes, I am adequately fit to approach and support patients. The most rewarding is the opposite end of that spectrum, where you have patients who have chronic diseases or who have chronic issues come in and they see results within a couple weeks. And it's patients who struggled with things for years,
Wow.
And it's just having a different outlook, a different perspective. And sometimes it takes a naturopathic doctor to come in and have that different approach. Just say, hey, let's start back with foundations. Let's start from square one.
Yeah.
And going from there. Yeah, that's
Do you have a story or two that you could share with us that actually you've changed somebody's life to the better, whether they were diabetic and on insulin, or they were able to reverse that, or something that had to do with mental illness?
Yeah, I would say mine is more so kind of related to, I have one or two stories, but the first one that pops into mind is a patient of mine who has Crohn's disease. Crohn's disease is a digestive kind of inflammatory disease process. And it does cause, going to the bathroom, and does have some bleeding associated when you go to the bathroom for number two. And it's sometimes hard to control. It causes you to lose weight. It causes you sometimes to have skin rashes. It does affect your GI, so you're not able to absorb nutrients and food. So being able to come in, recognize that, have herbal approaches, because medications do work to a certain extent, but having the supportive approaches and techniques to be able to tamper down the inflammation, bring about some healing. The patient was able to gain weight, you know, he never could gain muscle, he gained some muscle, you know, depression was gone, because all of that, the mental emotional toll does, you become impacted by that. So able to just turn around his health and go off to college and, you know, live independently now. So that's one success story where it's like, yeah, I mean, I understand you've struggled with this for years, but what I would consider, you know, a few simple tips was like greatly impactful for that situation. So that's the one that I'd say is the most. All the others are more like things that I typically see, you know, in women's health, a menopausal woman who may try an herb or try a bioidentical hormone replacement therapy and be like, you have woken me up to life again. And then their husbands come in and shake my hand. They're like, thank you. And I'm like, no problem, man. I'm here for it. And vice versa. As men, we don't go to the doctors as much as we should. So being able to have that male support with hormones and recognizing, hey, as a man, you shouldn't just settle. We go through a lot as well. And you should also strive to have the best health possible. So seeing it from both perspectives. But yeah, I would say those.
Yeah, I heard this recently that most of us tend to run on 60%, and then we, you know, ask, how are you doing today? Oh, I'm doing fine. I'm doing good. Yeah. You're doing 60%. Yeah. But you could be doing 90. Yep. Or almost 100. Yeah. Right? Optimal. That's possible.
Yeah, it is possible. We should be aiming for it every time. We don't always get there. But it's the lack of not even thinking that you need to aim for that. Yeah, that's where we fall short at times. So yes,
or the motivation sometimes, because that's for me. Yeah, like sometimes you know what you need to do. Yeah. Well, what do you like? How can you motivate somebody usually?
Sometimes I'm the greatest cheerleader. Yeah, because in realizing that just the simple things are impactful, like, if you want to have better energy, you might want to go to bed and at least aim for like 7 hours of sleep. Oh, you got 6 hours? Great. That's better than the 4 hours you did the night before. Yeah. Give yourself a pat on the back, you know, like truly appreciate the little steps, because we tend to have these great lofty goals of, I am going to shift this in my health, or I'm going to become this type of person. And while we see that goal, we don't see the baby steps that we need to take. On top of that, sometimes the steps backward that we need to give ourselves grace with. So sometimes just having a real good cheerleader behind your back to say, hey, you know what? You may not have hit 7 hours of sleep, but you actually hit 6.5, and we're going to aim for 7 the next time. Okay. But we're making baby steps. We're getting there.
Beautiful.
Yeah.
Wow.
Awesome. So where can we find you? Where can our viewers find you?
Yeah.
Need to learn more? Or?
To learn more, of course, subscribe to this channel. And then on top of that, you can reach me at dranthonyfrank.com. That's my website. You can reach out through there with a contact form. The office phone number is there. I do have 2 locations, one in Redlands and one in San Diego, where I previously practiced and still do. So those, I would say, are the best forms to reach me at. Social media coming soon, but honestly, the website and calling the office, I love to do discovery calls where, you know, I want to make sure it's the best fit. If you're going to invest in your health, I want to make sure I am able to provide you with the best health possible. And most of the time, I am. And if I don't, I know someone who can. So.
Cool. And you can put that in the description.
Yes, we'll put that in the description. The link and the website and everything. Yeah. But thanks so much. Yeah, this was so insightful, and
thank you guys.
I love what you do. Yeah, keep it up.
Thank you guys for this platform, and honestly being able to, you know, support health and support just various conversations.
Yes, I think every person needs to have a naturopathic doctor.
Yeah, in your corner. Even as a cheerleader, I'm here for it. I'm a very decorated doctoral cheerleader.
Beautiful. Thanks so much.
Awesome. Thank you guys.